I'm the permanent charge here at Hillview, and this is our flagship center. And I was asked to take over here, I would say, beginning of March or around sometime last spring. And I've been here ever since. So when a donor comes in through our doors, they first are met by our registrars, and they will, they're asked, you know, if they've donated with us before, because then that means that they're already in our system. And your first name? And you've donated with us before?
Yes, I have.
And what is...
Mountain View.
Okay.
Area.
And what is your date of birth?
22753.
And your street address?
It should be 2568 St. Lawrence Drive.
Perfect. And then we have them sit down at one of our Cassie machines. It's our computer screen questionnaire. And there they're asked our questionnaire. It's a touch screen. Once they've completed that, then a historian is notified, and they will go through the what we call the history process. There we go. Thanks for coming in. Please have a seat. My name is Lily, and I'm going to review your history. So they are in a history booth with a historian, and they go through all of the questions that they responded to on the questionnaire. And then we take their vital signs, which consist of their blood pressure, temperature, do a hemoglobin finger stick. The minimum requirement for donating whole blood is 12.5 grams per deciliter, and really what that's looking at is to make sure that they have enough hemoglobin in their system so that when they are complete with the donation process, I like to say they have enough red cells left over so that they can function normally. After they pass all of those things with flying colors, then we escort them into our donor room where they have a seat, and then we prepare their arm for the venipuncture process. The venipuncture process starts with us asking the donor which arm they would like to donate with. Instead of a standard tourniquet, we use a blood pressure cuff that we turn upside down because it does restrict the blood flow, but it is a lot more comfortable than having a rubber band tied around one's arm. And so we prop their arm up and we pump up the cuff and ask them to squeeze, and that helps allow the veins to surface, and then we can palpate as needed and find a vein and mark it to our liking. After the vein is marked, then we do a 30-second scrub of an iodine-based scrub. We have to let that dry for 30 seconds, and in those 30 seconds we are setting up the bag, counting our numbers. We will go in for the stick. So I'm going to have to put this mask on, and when I do it's very difficult to talk. So the reason that I have to put the mask on is because of the design of the needle. There is a hole on the other side of the bevel in the needle, and so there is a cause of a concern for a splash in my face. It's not because I'm afraid of you by any means. It's just to protect my face. And then when I put this on, I'm going to pump up the cuff and I'm going to say, go ahead and squeeze 3 times and hold on the third. And then I'm going to remove the gauze and say, and at this time, if you don't want to look, now would be a good time to look away.
Okay.
All right?
Okay.
I like to give everybody that warning. Sometimes it's a little nerve-wracking to see somebody with a mask. Hold on the third. And if you don't want to look, now would be a good time to look away.
Okay.
Okay?
Mm-hmm.
Okay, relax your grip. Is your arm in a comfortable position? Okay, we're going really slow here. In training, we are taught that if this is the vein, you want to go right into the center of the vein. Well, unfortunately, we don't have a camera at the tip of the needle. We can't see where we're going. So sometimes you go in and the needle's right up against the top of the vein, and it's not going as fast as it would if it was sitting right in the very center. All of these things can occlude the flow of blood, It depends on how hydrated, how well hydrated the donor is when they come in, and that has everything to do with the flow of blood. After an individual is done donating, it takes, I would say, anywhere from 3 to 15 minutes. Our philosophy is that if we're going to get the unit in 15 minutes, we'll get it. If we're not, it's not going to happen. We finish up the donation process, remove the needle from their arm, wrap up their arm, and give them post-donation instructions, and then they're escorted into an area for snacking cookies that we call the canteen. And there they are asked to sit for 15 minutes. The reason that they're asked to sit for 15 minutes is the likelihood of an individual having a reaction after their donation is greater within those first 15 minutes. And so we have a volunteer most of the time that sits and watches and visits with everyone to make sure they're not turning green and passing out.
Why do I donate blood? Well, because it's something I can give to somebody else. It's that little gift that you can make. It's personal, that can really help somebody else. It doesn't cost anything, but it's such a big impact for some poor person in need. I really like doing that. It has great benefit internally for me too.